So my name is Dr. Grant Pagdin, and my specialty is anti-aging and regenerative medicine. So I got into the field of anti-aging medicine about 6 years ago when I was the medical director at iQuest Healthcare. And the vision there was to make lifestyle alterations to move people's health forward, which really seemed to be a very proactive approach and a preventative kind of approach. So that's kind of where my interest started. I got board certified with the American Academy of Anti-Aging and Regenerative Medicine, which was a 2-year process, a bunch of education, some written exams, and some oral exams. And from there, my interest really kind of moved into more of the regenerative side of it, because a number of people find their physical activities to be curtailed by degenerative arthritis and chronic sports injuries and things like that. So I wanted to try to devise a method for addressing some of these problems, and the options, unfortunately, are rather limited. And unfortunately, until recently, there hasn't been a lot that we could do to try to reverse degenerative arthritis. So this is really where my interest in stem cell medicine as a tool for regenerating some of these degenerative conditions came about. We do have all of the things in our body that we need to heal up the joint. The problem, of course, with a joint with osteoarthritis is there really isn't a good way to get all those growth factors in there. There's very little blood supply inside the joint. The center portion of the cartilage of the joint really has very little blood supply. So although your body has good intentions of trying to heal itself, arthritis is unfortunately one of these degenerative conditions. Once it gets a foothold, it's going to gradually spiral downwards. That's why your orthopedic surgeon will say, come back and see me in 5 years and you'll need a new knee. He can tell, looking at the x-rays, where you are now. He knows where you're going to be in 5 or 10 years. So the way that we get around that is by actually introducing these factors right into the joint where they're needed. We can encourage the healing without relying on external blood supply to bring the factors in there. We actually import them directly, throw them into the joint, and allow them to do their thing.